So if a patient has head and neck pain, how do they know it might be TMD?
They don't. They really don't. Well, the obvious thing is if they're making a joint sound, or they're having difficulty in range of motion. That's opening and closing their mouth, maybe chewing. Every time they open, they're making a
that might be that
sort of sound. All right. So, and if they've seen a health professional like a dentist, or maybe even their physician, he might suggest, hey, you need to see somebody that treats this sort of issues. But then they come in, I see them when they get to me, I see them, and that's not really their source of pain. The pain is really coming from other areas. You know, that is an issue. We have to deal with it. We can't ignore it. It needs to be dealt with. But really what you want to do is you want to get to that source of pain. Where is that coming from? Let's get that resolved. Let's get those headaches and migraines taken care of, you know, all that head and neck pain that they're experiencing.
So at what point should a patient see a doctor like yourself if they have clicking in their jaw and they're young?
Yes.
And they just get it periodically, they don't have it on a regular basis. Should they come right away for a consultation to have that treated before it really leads to headaches and neck pain?
Well, yeah, actually, you know, it's not just for the younger, it's older individuals too. If you're having any question that you might have something like that going, yeah, really should be looked into, because it's going to progressively, in most cases, get worse. It doesn't get better. It doesn't heal itself.
Right.
But there's a lot of factors that can be causing that joint sound. And we need to identify it. Again, you don't necessarily have to treat it, because we don't want to treat just joint sound.
Right.
So if you're making a clicking or a little crunching sound in your joints, and you can hear it,
it's going to get worse.
It might be something, you know what, just be aware of it, but at this point it's really not at the stage. You might say you're just more susceptible to probably having a problem. But be aware of it, though.
Right.
It's really quite important. And I think the mistake is, with many doctors, is that they ignore it. It'll go away. It'll go away.
Because it kind of does come and go for some people in their younger years, and then it can stimulate to be more of a consistent ongoing problem and develop other issues as well.
That's right. Absolutely.